Ladies and gentlemen, it's a great pleasure to host you as a Polish Telemedicine and eHealth Society to the international webinar on telemedicine and eHealth. So this is a new invention, already third time in the webinar, and let me introduce Professor Michele Griffith, the president of International Society of Telemedicine and eHealth, to open the webinar.
Yes, thank you very much. Good day. I'd like to thank everyone for attending this webinar on updates and digital health transformation in Poland. I'd like to thank our leadership and members of the Polish Telemedicine and eHealth Society. This happens to be part of a monthly webinar series hosted by our national members. They are filled with information and updates, and I hope that, and I'm sure it will be quite beneficial and hopefully engaging. I'm just going to share my screen so that I can share a little bit about our Global Digital Health Network, the ISfTEH. And please let me know. I just want to make sure that you can actually see my slide. Please, someone let me know.
Yep, perfect.
Yes, perfect. Yep. Okay, great. So the International Society for Telemedicine and eHealth was founded in 1997. We're coming up on our 30th anniversary, founded in Basel, Switzerland. The ISfTEH is a global nonprofit network advancing the adoption of telehealth, digital health, and virtual care. With members in over 100 countries, we connect healthcare professionals, researchers, innovators, and institutions to foster knowledge exchange and collaboration. We are recognized as a non-state actor of the World Health Organization since 2008. Our focus areas are global knowledge sharing, interdisciplinary collaboration, digital health education, accreditation and standards, policy, compliance, regulation, and cross-border telehealth, capacity building, and digital health equity. Our specific services include working groups that we've established on specialized topics, webinars, podcasts, and international conferences and partner events. We have education programs, which include digital health courses, ISfTEH endorsed programs, courses, and training. We have an annual student research contest and awards. We do support the World Health Organization Global Digital Health Strategy, including research initiatives, and we are part of the Global Telemedicine Community of Practice. We have a journal partnership with Telehealth and Medicine Today. Our members collaborate on white papers and research. We have a number of categories of membership, including national, institutional, corporate, individual, student, and nurses. Both student and nursing categories have free membership, just to keep in mind. Collaboration is a significant part of our value and success. ISfTEH drives digital health adoption through strong partnerships. By collaborating with key stakeholders, we accelerate progress and ensure best practices reach the most in need, those that are most in need. We are very intentional about bridging the digital divide and ensuring equitable access. We prioritize telemedicine for underserved populations. So if you have any interest, we are more than happy to have you join this digital health network as we continue to improve access to healthcare and improve outcomes globally through digital health transformation. All right, thank you. I'll hand it over back to the host.
Thank you very much. And let me introduce Hassan Ghazal, who is a spirit of this new webinar series, and to ask him for a welcome speech.
Thank you, Professor Gringowski, for this introduction. So as you said, I am a board member of the International Society for Telemedicine, representing the association, along with Professor Oti and Professor Vitali from Ukraine, Oti from Finland. that replaced Professor Pirko, also from Finland. So it's a real pleasure to join you, to welcome you to this new session of the National Group's webinar series. This series actually is meant to be more than a sequence of webinars, but a real platform for exchange and mutual learning among our national member society. The vision is to create a space where countries can share experiences, showcase innovation, and discuss challenges. Over the past four sessions, three sessions, we showcased this in Finland, then India, then Nigeria. We have seen the richness and diversity of initiative taking place across our network, which means across the globe. So each webinar has brought inspiring diverse examples of how telemedicine and digital health can improve access, quality, and continuity of care. So today we are especially pleased to spotlight Poland. Poland, the country, a pioneer country in telemedicine that has made remarkable progress in telemedicine, clinical informatics, and digital health generally. So the Polish Telemedicine and eHealth Society that Gołękowski is representing has played a leading role in driving this transformation, and its work stands as actually as an inspiring example for all of us. So I would like to warmly congratulate and thanks Professor Gołękowski and Dr. Thomas Sidro for their excellent work in organizing today's webinar. I also would like to acknowledge the valuable engagement of Professor Pirko, Oti, and Vitali, whose continued support helps strengthen this initiative. But more broadly, I would like to express my sincere appreciation to all ISfTeH national representatives. Colleagues, your commitment is what gives life, substance, and continuity to this series that will continue for at least the next 2 years. A special words of thanks goes to Dr. Michele Griffith for her strong leadership and encouragement. I would like also to recognize the outstanding work of Frederick Livens and Nihal Habib, whose dedication behind the scenes is essential of making this initiative successful. Today's webinar program fully reflects the spirit and objective of this series, sharing national experiences, learning from one another, building bridges across borders. So many thanks to our Polish colleagues, to all speakers, and to everyone joining us today. I wish us an excellent webinar. Thank you for attending.
Thank you, Hassan, for your introduction and welcome speech. And let me start my presentation. I would like to present what has been done, what is now, and what are the perspectives in Poland.
Yes, the slides are ready. Can you see the slides?
Not yet.
Oh, I need to reshare again. Okay.
Ladies and gentlemen, what is happening in Poland? The progress and history, and what are needs? I would like to present in the next slides. The next slide, please. We can observe 5 phases of development of the telemedicine and e-health in Poland. The first phase was before 1995. It was a technological proceeding circumstances. A lot of tools were developed and some ideas were shared. And then we came to 1995 with enthusiasm, research, and early development. A lot of pilot projects, a lot of introductions, and that was a very enthusiastic time. 2015 in Poland is the date of the regulations in law, and that was a period of foundations until 2019. A very bad time for people, but very promising and opening for telemedicine was the COVID pandemic, It was a catalyst for its progress from 2020 to 2022. And from 2023 on, we observed toward the way toward maturity, integration, and AI. Next, from technological preconditions to integrated healthcare. Next. Here are the charts of Polish telemedicine history. The first wire transmission, the distance 500 meters, was performed in Lviv, from the Department of Infectious Diseases to the Department of General and Experimental Pathology. And ECG was documented in 109 patients, of whom 90 had diphtheria and 19 had a diphtheria complicated by croup. Next slide, please. The first paper published in Polish in Poland, 1996. Next slide. And the foundation of Polish Telemedicine Society. Next slide. So the Polish Telemedicine Society and ISfTeH, because it was the first name of our international organization, it was the same month, May 1995. And we joined the International Society in 2004, and the society has changed the name in 2005 into actually used one, the International Society for Telemedicine and eHealth. Next slide. So we are still under the umbrella, and we are happy to be with all of the other international societies building up the progress of telemedicine and eHealth. Next slide, please. We organize for ourselves and other colleagues from all the countries around the world international conferences, telemedicine and eHealth. We organized it once a year. Now we organize workshops and scientific conferences twice a year. So welcome to join our conferences. Next slide. Together with the foreword by Professor Michael Nerlich, the former president of ISfTeH, we presented the advances. It was a book about international progress in 2006. Next slide, please. So in our input into the telemedicine definition, so we call it medical service provided interactively between physician and the patient, with the physician bearing full professional responsibility equivalent to the traditional in-person care. Next slide. So we are involved into teaching of medical teleeducation since 2004 with the teleeducation app. Next slide. The first international orthopedics and scientific video conference has held in Poland in 2005, also with the participation of Professor Nerlich, former president of ISfTeH. Next slide. And we organized with the Center of Teleortho several webinars, next slide, including the live orthopedic surgery, next slide, and telerehabilitation. Next slide, please. We developed also this very specific system for early scoliosis and other back deformities detection among children and adolescents at schools, making it more than 20,000 examinations during 3 years in early 2010 until 2016. Next slide. But about the history, you can also find some information in the open access articles. Then next slide, please. So This is a referral of the real path of ongoing digital health maturation. You can see on these cards from the first tele-ECG through the Polish Telemedicine Society Foundation, telemedicine recognized in law, and introduction of e-prescriptions in 2020, e-referrals, until from 2020s, we are going from tools to systems. Next. So in Poland, we have a visible ecosystem for telemedicine and e-health that includes patients, that includes medical facilities and care providers, institutions and organizations. They are linked over the digital infrastructure and services like platforms, digital systems, telehealth services, regulations, standards, guidelines. Next. So the telemedicine and e-health is not anymore in the pilot phase. We can observe some improvement. What has improved? It's the infrastructure, scale, access, visibility, acceptance. However, there are still lags then like interoperability, workflow integration, quality assessment, consistency across settings, and workforce preparedness. So the adoption of the telemedicine tools and e-health tools doesn't seem to be equal to maturity. So to achieve the maturity, we need some more. We need to go to the next phase and shift from quantity to next step, to value. Next, please. So the hard part starts here because systems still do not connect well enough. Evaluation is weaker than implementation. There's some lacks of outcome-based goals and KPIs remains a systematic weakness. Tools do not automatically fit clinical workflows. Regulations often follows practice too slowly, and clinicians are expected to adapt without enough structured preparation. So we need more integration, quality, usability, and accountability, not only access to technology. Next, please. So we know the tools do not treat patients. The clinicians, the doctors, the physicians do that. They do it if they have workflows to do it, they have systems to do it, they have a clinical judgment and responsibility. So the technology becomes healthcare only when it works in real clinical practice. Next. The next bottleneck is clinical readiness. So we assume that digital competent practice requires teleconsultation skills, educated and taught at school and the university, remote examination logic, interpretation of remote and patient-generated data, safe digital communication, documentation, critical use of AI, structured education in telemedicine, digital documentation, AI literacy, and judgment in hybrid care pathways. So the digital health needs digitally competent clinicians. Next slide. So why clinical informatics and digital medicine matter, I would like to give you some responses about this question. The healthcare is becoming more digital, data-rich, and system-dependent. AI is entering clinical environments daily. Hybrid care is becoming normal. Accountability is increasing. Clinical leadership at the medicine technology interface is now essential because we have the digital transformation everywhere. Education and competency frameworks must catch up with practice. So the future digital health depends on clinically grounded digital leadership. Next, please. What is in Europe, in Poland as well, of course. The European Health Data Space Regulation, it's something that is brought by Official Journal of European Union that entered into force on 26 March 2025. The regulation that increases the importance of cross-border data interoperability, it aims to establish a common framework for the use and exchange of electronic health data across the EU. Next, please. So we need more than enthusiasm. Clinical informatics and digital medicine. We expect that's a possible model for European super specialization that is already established in the United States and few English-speaking countries. The entry of pathways should be for physicians after primary specialty training, expected duration 2 years, with some core curriculum that should cover telemedicine, digital workflows, health information systems, clinical data standards, AI medicine, and many more, including ethics, all for physicians able to connect clinical care, digital systems, policy, and innovation. Next, please. So the clinical informatician and digital medicine specialist, you can see this specialist on the right chart. And this is a credible professional foundation since 2013 in the United States, where the specialty is established as a physician subspecialty focused on clinical workflows, decision support, information system, and safer care delivery. So in Poland and Europe, it should be considered. NHS in England explicitly links digital transformation and with digital leadership, board level informatics roles. So the name of the specialty rather should be directed to clinicians, and the digital medicine should work well and better than simply clinical informatics. Next slide. So what Poland needs next, the better interoperability, move from volume to access metrics of outcomes, quality and prompts, informed evaluation, better education for hybrid and digital care, smarter AI implementation, clinically meaningful innovation, and the leadership in clinical informatics and digital medicine. Next slide. So the take-home message, that Poland has already moved beyond digital tools, and the real challenge is now turning them into integrated health systems, measurable quality, safe workflows, and digitally competent clinical practice. So next phase of digital health is not more tools only, but better systems, quality, and prepared clinicians. Next. Today's webinar logic, you can see, and you will attend, we'll talk about the tools, systems, practice, and talks are not isolated examples, but the part of the shared trajectory. Next. Thank you for your attention. Thank you very much. Let me introduce the next speaker. Professor Rafał Doniec, he will tell us about artificial intelligence in dental materials.
Thank you very much for your stage. Good afternoon, ladies and gentlemen. My name is Rafał Doniec. I represent the Medical University of Silesia in Katowice, of course, Poland. Today, I will just really very briefly present the artificial intelligence into transforming more than density, not only the medicine, but density, and particularly in the context telemedicine and digital healthcare system. Next slide, please. I should just upload my presentation, or you just
No,
prefer?
can you see the slides, Rafał? It's the
No,
second slide
not
on
yet.
the screen sharing already.
No yet. No yet. If that is possible, I can just share with my slides, my presentation, if that is the technical problem.
Okay, so is the slides screen visible?
No,
For
not
me,
yet.
it's
Not yet. Not yet.
Yes, we
shared.
can see.
Yeah, for me
Yes,
also,
it's
I can see the slides.
Ah, technology.
so just only me
Maybe
is not visible, the slides, my slides, or everybody else is just visible?
Now, now not, but before was.
Let me restart sharing. Sorry for that.
Okay, so I will just, yeah,
Maybe
that is
again.
visible right now. Everything is perfect, Thomas. Thank you very much. So from the second slide, I will just shortly just reminding and just present the densities like a border healthcare system, that is for sure. And undergoing is like a rapid digital transformation as well. We are moving from the traditional clinic-based care toward data-driven hybrid or increasingly remote models. Key to drivers include the growth of the teleconsultation, quite obvious, integration with the digital imaging, and availability with the large-scale clinician data sets, yeah? And artificial intelligence plays the central role, connecting these elements into the coherent diagnostic decision support framework. Please, slide 3. Next slide. Yeah. Artificial intelligence enables automated analysis and the complex biomedical data, particularly in dental imaging and the patient monitoring. Examples, detection for caries and the periodontal diseases, analysis of the radiographs and CT scans, and predictions and treatment outcomes. Importantly, AI does not replace clinicians, like said before, Professor Glinkowski, that enhance that diagnostic precision and supports the clinical decision to be more trustful. Next slide, please. We combine with the telemedicine, AI also the extended dental care beyond the physical clinic. Patient can submit images remotely, receive the preliminary assessments, and target more efficiently. That especially valuable for the understanding areas where access especially is limited, and AI-driven teleconsultation system can significantly reduce diagnosis, delay, and improve the care. Next slide, please. Another important application is the medical education, like preparing next generation to that system. AI based on the system can simulate the clinical scenario, supporting the training in the teleconsultation, or like on that slides, preparing students to do some kind of test of material, dentist composites material, for example. And this is particularly relevant to preparing future clinicians, cooperate with the engineers, and the stomatologists that cooperate with the materials specialists for digitally enabled healthcare environments. Next slide, please. Despite of the potential several challenges remain. These include the data privacy and regulatory. They need the high quality announced data sets, and they need the AI incredibly models and understandable and trustful AI models. Ensuring trust, transparency, and the credential validation should be essential for the widespread adoption. Next slide, please. Looking forward, we expect together to integration, multimodal data, real-time monitoring, and the personalized treatment planning. AI will be increasingly support all of this diagnosis, but also prevention in the long-term patient management. And final, please, slide. So in conclusion, I'm just thank you very much and invite for any cooperation with the Silesia University of Technology, and I just wait for the discuss in the end. Thank you very much.
Thank you, Rafa, for your very interesting presentation. And we see also dentistry is being involved in the whole process of AI and telemedicine. And now I would like to invite Barbara Jacennik, who will tell us about medical education for teleconsultation. The floor is yours.
Thank you, Professor Glinkowski. I am an academic specializing in health psychology, health communication, and some aspects of healthcare administration or management. Advantages of teleconsultation are well known. There's a lot of research, but the main ones are the accessibility to patients remotely, potential for regular and continuous care, influence on patients' motivation and adherence to treatment, and enabling the monitoring of patients' health and functional parameters. Next, please. The problems or disadvantages on introducing teleconsultations are here on this diagram. The barriers are in the categories of technology, infrastructure, skills, competencies, the habitual preferences of users of healthcare, the trust and security with introducing novel solutions, the regulations which had to be changed in all countries, and financing. And this is for all perspectives: patients, healthcare professionals, administration. Okay, next one, please. Okay, so this is a preview highlights of a publication project, which is a review of studies, a scoping review of studies on teaching teleconsultation skills in undergraduate medical schools. Next one, please. We have identified 48 records, and this was filtered down to 11 high quality and subject related studies. Next one, please. In those studies, there were covered countries such as Turkey, United Kingdom. A lot of, probably we have not covered the US, as I recall, but most continents were covered. And the students were from third to the fifth year. That is the clinical education years. Next, please. In those studies, the researchers used a variety of methods of teaching skills. Here are some examples, such as clinical role play, AI simulated patients, or human simulated patients. Next one, please. Next slide, yes. And the skills and competencies trained were both the traditional ones and those related to teleconsultations, such as ethics of teleconsultations, managing uncertainty, and other. Okay, and next one, next slide, please. This is just a few items. Next one, please. These are the results, the learning outcomes obtained in those studies. But as I mentioned, there were only 33, and there was a variety of them. So just mentioning a few, such as. Okay. Okay, so maybe this will be present on YouTube. So next one, please. I can go on to the summary that most of the studies have shown positive effects, learning effects, with some cases where there were some lacking of learning outcomes. In particular, it was in the case of maintaining the structure of interaction of the teleconsultation. But in general, the results of our review show that it is possible to teach successfully teleconsultation skills at the level of undergraduate medical education. Thank you for your attention.
Thank you, Dr. Etsendik, for your interesting presentation, and we expect the full paper soon. The next presenter will be Tomasz, and I'd like to invite him to present the independent eHealth and R&D. The floor is yours.
Thank you. Hello, everyone. I'm Tomek Cedro. I'm the Vice President of the Polish Telemedicine and eHealth Society, also founder of the CDROM and IQ Credo. So if we want to make a world a better place, we need to find what's to fix and how to fix it. So we need to invent a solution, but the solution needs to be implemented, preferably as a product that can be delivered or created or recreated around the world. So I'm not a doctor, I'm an engineer. So engineering is a very important part of the eHealth and telemedicine. So how to change our ideas and concepts and solutions into working products. So that's kind of entrepreneurship challenge. Let's see if really we want to change the idea into products. So in theory, we just need a funding, research development, and then we have a solution. But as reality shows, it's not that simple. We need to have a business model. We need to have a detailed specification. Then if we want to manufacture some hardware, we need to, hire a team of engineers, have a designing, prototyping stages. These are iteratives. You select components and so on. If you want to create a software, for example, an operating system, a firmware for an embedded system, the database, the mobile application, so also that involves a team of engineers. Then we want to manufacture, so we need to have a so-called delivery chain, funding assured, distribution channels, transportation. Then if the product is ready, we need to sell it. So we need some selling channels, volumes, distributions, and so on. Then we need to advertise, have a marketing team. Then if we have a working business, then we need to provide a maintenance for the product. So it's like update, servicing, transport, and of course, all of this requires highly skilled people. So it's not that simple as it seems at the beginning. So the open source might be a solution here because we can reuse the existing blocks, from around the world that people have created before. That's a really complex task, and it's good to remember that we are standing, on the shoulders of the giants that took their precious time to create and share some solutions for free, and we can reuse it, we can adapt it, we can develop new solutions based on that. In order to avoid the problems with the delivery chain, we are assuming the commercial off-the-shelf components, so there could be easily replaced. In order to avoid very time-consuming and expensive certifications, we are focusing right now on the consumer-grade products. And maybe also the open source products, so open source hardware, like these food blueprints can be delivered, or spread around the world, and people just can recreate the solutions. So we want to create something that will be low cost, available, globally usable, helpful. And what are the enemies? So bureaucracy, for sure. We cannot operate without having a company and following some rules. If we look at the Moore's law, that states that every 2 years the number of transistors in the microelectronics doubles. So that implies the exponential growth. So if we look at the right-hand side slide, the top one, it's the for example, the universe of growth of the Linux operating system and distribution. So it's really too big to show in one picture. It's a whole universe. For example, we choose the BSD Unix distribution. That is simpler, more predictable. If we look at the programming languages, for example, the basic programming languages, the C programming language was created like over 50 years ago, and then it had like around 4 updates, while the modern programming languages tend to change more and more often. So the same with the libraries, the components, the building blocks of the microelectronics. So the decision that we make at the beginning of the project, they impact the whole solution, the whole process, the whole company, the business, how it works, if it works, how it is expensive, So this is why the open source might be a solution here, and the independence here in the research and development in area of eHealth means that we own the results and we can decide what we do with this results, whether we want to commercialize them, how we want to commercialize them, if we want to sell them on our own, if we want to sell them as IP licensing, or we just want to share as a open source software and hardware. So that's it from me. Thank you.
Okay, thanks a lot. My name is Krzysztof Świtała. I represent Cardinal Stefan Wyszyński University in Warsaw. Well, with my colleague Bartłomiej Michalak, we create for you presentation about internet patient account in Poland, especially in the mobile form. Okay, we can jump to the next slide. The definition of IKP, internet patient account, gives us a hint that that service is mainly front end for another services in the information healthcare system in Poland. For example, especially electronic health records access. Okay, we can jump to the next slide. If we want to present the key functions of the internet patient accounts, we should focus on medical records access. Included prescriptions, included referrals. Also, we should say about health declarations, for example, declarations connected with medical treatment. So here we talk about informed consent, for example, the evidences of that. Another thing is access management to our medical data. The next thing is a cross-border eHealth. That's the area under development because it's connected with previous mentioned European Health Data Space Regulation. We are at the time of under development of this regulation in European Union, not only in Poland. Okay, the next thing, the prevention, information about prevention of health. That's also information connected with functionalities of the IKP. Okay, we can jump to the next slide. Okay, if we want to talk about key functions of the mobile form of this application, it's quite similar than in web version. But it's more connected with a using of a mobile equipment like a smartphone. That's obvious thing. Okay, I think we could jump to the next slide. Okay, here you can see the legal framework connecting especially of the area of European Health Data Space connecting with eIDAS Act of Trust Services in the European Union. Here you can see also GDPR, the problems of privacy and data security, NIS directive, also connected with cybersecurity, we should mention in this area, and also some technical standards like ISO standards in the area of data security. If we want to talk about authentication, authentication layer, for example, for mainly for patients, the main types of services here is regulated by European law in the eIDAS, and also in Polish law we have a trusted profile. For example, we have an eID. Also we have a mobile mCitizen application, mObywatel. And that application is connected, is interoperability with internet patient account in Poland. Okay, we can jump to the next slide. If we think about the maturity of eHealth systems in Poland, we can see that Poland is one of the leaders in the European Union of the developing services connected with electronic health records, for example. Okay, we can jump to the next. And then the last slide. Okay, so as a conclusion, we can say that we are at the time of development of new regulations, for example, on the our member states area, on area, local area in Poland. That's activities connected with implementation of new regulation in European Union legal system, like eIDAS 2, like EHDS, European Health Data Space Regulation, and also now we are at the time of development of a new regulation in area of cybersecurity also. So thank you for your attention. That's all for me, from me for today.
Well, let me introduce
Thank you very much,
Professor
Krzysztof.
Krzysztof
And right now,
Wroch.
Krzysztof Wroch.
Krzysztof, the floor is yours.
Thank you for the invitation and the introduction. I am Research Development and Innovation Project Coordinator in the DAC Digital, and at the same time a member of Polish Telemedicine and eHealth Society. In this short presentation, I would like to introduce all of you to uTrains project that is founded by the EU funds from the Horizon. The project focuses on wearable technologies for multi-sport training and remote healthcare. The project connects sensors, software, and artificial intelligence in one place, and the goal is to turn the data in real time into some sort of useful information. This is very important because remote monitoring should be more than sending a lot of raw data into servers, cloud servers, and waiting for the answer. What we need is really a safe, continuous, and useful observation over long time and quite fast feedback. Another important point in the uTrains is that it is based on the European technologies and European supply chains. This is very important for trust, resilience, and long-term independence. So in short, the project is about building a European ecosystem for smart wearables, meaningful health data, and possibly future of digital healthcare. Let's move to the next slide, please. The value of uTrains comes from the system by design. We use the edge-first approach. This means that the data can be processed on the device or close to the device. This gives the users lower latency, it improves privacy, and it reduces the need to send large amounts of data all over the time to the cloud servers. At the same time, the cloud is still in use. It has even important role as it can support a long-term analysis, model improvement, and learning from a larger data sets and self-improve when that time goes by. We also believe strongly in multimodal data fusion. A single sensor gives only part of the picture when we analyze a subject. But when we combine data from many sensors, we will get much richer view of the user's condition at that time. This helps us make better inferences and conclusions than with only one sensor. This has also a strategic meaning because if we build this solution only on European chips, cloud, and infrastructure, we reduce dependence from third parties. And it makes the health technology for citizens of the Europe safer, stronger, and of course more resilient. And looking ahead, the same approach can be not only applied to remote healthcare, but also to sports, rehabilitation, health prevention, and many other human-centered applications. I hope that this topic will find some interest, and if it does, you are more than welcome to cooperate with DAC Digital and get the best you can from the findings of the uTrains projects. Thank you.
Oh, thank you. So I guess I can start.
Sorry. Yes, please, Shimon. It's the floor is yours, of course. Please start.
Oh, thanks a lot. So next slide, please. So in this presentation, I would like to share with you some insights into the Capable project. Capable stands for Cancer Patients Better Life Experience. So actually now we are faced with a situation when cancer becomes a chronic disease. So patients are mostly treated at home and they only experience occasional follow-ups or hospital visits. So it means there is a need for a new or extended model of care with continuous remote monitoring and support, both for patients and clinicians. So actually, there is a nice opportunity for a telemedical solution. And responding to this challenge, we designed and developed a Capable system. It provides coaching to patients, decision support to clinicians, and actually its overall goal is to improve the quality of life of cancer patients. Next slide, please. So here you can see the overall architecture of the system. We have the data platform, a repository of clinical data in the center. It uses well-established standards. We have a set of AI components that provide support to clinicians, coaching to patients, that identify conflicts between these recommendations. We also have two specialized front ends. There is a web-based dashboard for clinicians to provide the support, and also a specialized app for patients that supports coaching. Patients use this app to report symptoms, and they also wear smart watches for continuous monitoring of vital signs. Next slide, please. So in the system, we rely on evidence-based support. Specifically, we use clinical practice guidelines, in this case, ESMO guidelines that are for managing toxicities associated with cancer treatments. These guidelines are formally modeled using Proforma, which is a dedicated language for clinical guidelines, and also a tool set for executing them. And each guideline is before modeling is split into two parts. We have a patient-oriented part and a clinician-oriented part. Next slide. So we also support patients with so-called virtual capsules or virtual pills. So these are non-pharmacological interventions that are aimed at improving patients' physical well-being. So there are different types of exercises, for example, walking or yoga, or improving mental well-being. So as you can see, there are interventions such as deep breathing or imagery training. And all these are supported by the patient app. So next slide, please. And just to summarize, so Capable proved to be beneficial in a clinical trial for patients with kidney cancer. It improved their quality of life over the period of 6 months, and also it increased their cancer-related fatigue over the same period. So results are encouraging. There are some challenges we need to face, but we are generally positive. So thank you for your attention.
Thank you for your great presentation. Let me introduce Piotr Krajewski with his presentation on telepathology with Cancer Center AI platform. Piotr, it's your floor now.
Yes, hello. My name is Piotr Krajewski. I'm CEO and co-founder of Cancer Center from Poland. Our history starts from Jakub, son of my brother, have a brain cancer, and I saw how the process looks like, how it's so long, and that was very stressful situation. We saw that we have to wait for first and second diagnosis so long, mainly because of the reason of not enough pathologies in pediatric cancers. Please share the next screen. So the main problem is, as I said, not enough experts in this area, but other problem is that they work with microscope without digitalization, and it takes more time. They work for many hospitals. They have to travel between hospitals because, for example, in Poland we have only 350 people in this area. In Germany and other countries is a similar situation. As the last speaker said, the number of cases grow up, but at the end, we don't have enough people to analyze data. So AI and digitalization help in this process, and we focus on this. Please share the next screen. So our history started in 2020, where we focused to develop a platform viewer for pathology slides. But the problem was that the pathologists not use digital slide. They have manual slides and watch everything and analyze through microscope. So that's why we developed solution for digitalization data from the microscope and camera. We stitched data from microscope. It's an alternative, cheaper alternative for buying expensive scanner. Then we start working on AI modules for prostate cancer, but also we develop radiology module for DICOM viewer, because we saw that process starts from radiology step, and then we have a pathology step where the pathologist examine and give the end diagnosis. But working with pathologists, we saw that they need also a laboratory information system, but focus on pathology labs. So it's different process than typical laboratory where we have urine and blood, because they have much steps to analyze and prepare slides and from the tissue. And this year and next year, we plan to also add molecular biology, get genetic module and other AI modules. And we plan to also open the platform for any AI module in pathology and radiology area, where the hospitals and the medical staff could analyze data fastly, and it's our mission to increase the time of analysis and also quality of analysis. Please share the next screen. So you can see right now how the pathocam work. There is a view from camera, microscope camera, and where the pathologist move the mark, check the slides, analyze slides. We stitch the data together and send whole image, whole slide to the platform where it could be analyzed, share, and remote diagnose. On the next slide, you can see the viewer. So this is the result of AI. This is AI model for Gleason score, where the pathologist could analyze automatically by AI grading of the cancer from the tissue, from the biopsy of the prostate gland. And we also implement different AI models for breast cancer, lung cancer. And as I said, we also want to give access to third-party models, not only ours. So it will be, the user can use an AI model which prefer. And the next slide, you can find the view, the slide from the laboratory information system. It's a web system interface. It could work locally on premise in the hospital infrastructure, but also in the cloud remotely. So it's implement whole process in the laboratory from the order, from the hospital, department clinicians, to the result, to the pathology result, and we also send the feedback to the government platform P1, where the patient could see the result automatically. And the last model, viewer. The next slide, you can see the result of AI, which automatically recognize prostate gland on the DICOM, on the MRI, and help urologists, the clinicians, to do precise biopsy, because it's other problem if we don't take right tissue from the right place, we have wrong diagnosis. So the point is to help also on this step. And this viewer and AI model could also help in follow-ups where we have a cancer patients who have to do follow-ups every year and check the progress. Yeah, our traction till today, we have more than 20 hospitals, but it's not only hospitals, it's also medical university, which use our platform for diagnosis, but also for education, because we share our platform also for showing the cases on the conference. And it could be also pro bono barter cooperation, where we want to increase digitalization and also speed up the process. So we focus also in this area. We have the platform is open for everyone, so the patient could also go in, register, and put the own data, but and could share to any clinicians and physicians by this platform. So we focus to give technology for also for patient, but patient decide who want to share it. The platform is open, and that's our goal to help also at the end patient, not only physicians. And we also work with pharma companies where they interest of speed up diagnosis and prepare right drugs for cancer treatment. Physicians and pathologists and user of the platform are very interested, and it's user-friendly interface. So that's the main point, because we know that physicians have a lot of job, not enough time, So we don't want to give them additional time to fill report, fill everything. So we add the features like voice to text, where the patients, where the physicians could speak to the interface and automatically recognize text and fill the report automatically. The same by AI. So the focus is to spend less time with interface and to use AI for this. Yeah. So if you have any questions, please write or touch, or yeah, I am open for any questions, and we also open for any cooperation globally. Thank you.
Piotr, for your excellent presentation. I'm impressed, and this is a show of the particular need you experienced, and you developed a perfect tool, perfect application. So congratulations. Let me introduce Paweł Elbanowski, who will show us also interesting invention, the smart stethoscope. Paweł, the floor is yours.
Thank you very much. Nice to meet you. My name is Paweł Elbanowski. I'm the co-founder and CEO of ISfTeH, and I want to tell you about our electronic smart stethoscope. The system consists of three modules. One is electronic stethoscope, so the hardware which allows you to record the sound, the mobile application, and the platform which shows you and gives you the access to AI reports. Please, next slide. Electronic stethoscope connects to the mobile application. The application guides you through the whole process. You just have to place ISfTeH on your chest in the indicated point, and you can record the data. AI algorithms will analyze those data immediately and will get you the answer, what happens within your lungs. And you can share it directly to a doctor if there is a need and problem within your lungs. Please share the next screen. ISfTeH AI analyzes and detects wheezes, rhonchi, coarse crackles, fine crackles, so sounds characteristic for asthma, pneumonia, laryngitis, bronchitis, COVID, COPD, many different chronic and infection diseases. Moreover, we are calculating respiratory rate, heart rate, and inspiration to expiration ratio. Those parameters helps you to diagnose and monitor the treatment of patients when they have issues with the respiratory health. Next slide, please. This solution is a medically grade device, so it's clinically proven and validated on top of this with the University of Bordeaux, Monash University in Australia, or Johns Hopkins University in Baltimore. We have 16 peer-reviewed scientific publications where we proved accuracy of our technology. We had found European grant where we recorded over 600 patients for over 2 years to get the data for our algorithms and to prove their effectiveness. We had 2 programs with Ministry of Health in Poland with across 80 primary care centers. We have recommendation of Polish Society of Allergology and Polish Pediatric Respiratory Society. And this solution is already on the market where everybody can buy it for home use, but also for the nurses who can go for the home visits and use this technology. Next slide, please. It's clinically proven, as I mentioned, and here I want to share with you the Annals of Family Medicine journal where we published results of our technology for the asthma detection and asthma exacerbation detection. On the slide on the right side, you can see that ISfTeH has better accuracy in detecting those exacerbation in all age groups, especially in kids, because in kids and elderly people are not able to properly blow, for example, using the spirometry. But ISfTeH you can just place on the chest without any additional. The patient does not have to do anything more than just breathe. That's why it's ready and easy to use for all patients. That's why we have accuracy on over 90% level. Next slide, please. The same results we see we have in cystic fibrosis. So exacerbation in cystic fibrosis, those patients really need help because they have huge problems in daily life. So in the monitoring and treatment, it's a huge value for them. We don't have to push them to go to the doctor's office every time. Next slide, please. STETOMI also proved that having STETOMI can minimize unnecessary doctor's visits. Here we have results of 6 months study period where there was 4 groups of chronic disease of diseases: asthma, COPD, obstructive sleep apnea, and allergic rhinitis. In all groups, on the left side, we have the number, how many times those patients were visiting doctor's office in hospital, emergency room, specialist clinic, or primary care clinic. And in each group, we proved that having STETOMI minimizes unnecessary doctor's visit. I mean unnecessary because patients have doubts and they need the answer. But having STETOMI, they can get the answer, what happens within their lungs, in just 2 minutes without going to doctor's office. So we are saving both patients and doctors' time, and we are saving money for the healthcare system to let doctors take care of those who really need their help. Next slide, please. AI-supported auscultation, there are plenty of benefits out there. But to summarize, clinically proven effectiveness, because it's a medical device, it's a new standard in chronic disease management. There are fewer unnecessary visits and hospitalizations and better outcomes at lower costs. Next slide, please. Especially the use of this solution should be in telemedicine groups where we enable remote auscultation and make a full diagnosis based on the results from the AI technology. It helps doctors for the early detection of exacerbation in patients and remote monitoring between the visits, and it helps nurses on their daily basis, because if they see the patient, they can more confident make objective judgment on the patient. The last one, please. STETOMI. Less guesswork, faster decision, better outcomes. Thank you for your listening.
Thank you for the great presentation and excellent invention. So congratulations. And I think it was the last presentation from our set of presentations. So, and we are inviting you to take part in the discussion. We have already
I think we have a special guest,
several questions
Patricia Bizińska. Would you like to
in the chat? So probably we need to address them.
Okay, so there are several questions. Are the slides available afterwards? So the webinar is recorded. It will be available on the YouTube, so you will be able to reply the slides, the contents, the speeches. And let me see the questions. Now this is the time to ask the questions. Please fill them in the chat.
There are questions in the chat already. So about any solutions to analyze medical documentation, including doctors and nurses' notes and other textual data to assess patient condition, detect complication, identify gaps in the documentation. It is increasingly appearing some apps, including the already AI models available. So it is necessary to collect the information from the medical documentation and share without, of course, the names and other sensitive data, and share to the large language models. Sometimes, personally, I use Perplexity or Claude or ChatGPT for the discussion, and sometimes after finding the key points, I'm searching the literature and finding the articles in the on the located in the PubMed or other uh, uh, locations, including the Google Scholar in some cases. So I don't know exactly. Maybe someone from the audience is able to respond, or from the panelists is able to respond this question.
So maybe just a short comment. So maybe it's not the exact functionality, but there are some systems like Epic, which is very popular in Northern America. So it has modules for CDI, which is clinical documentation improvement. So maybe it doesn't provide diagnostic suggestions, recommendations. However, it checks documentation for possible gaps, for possible improvements. So I haven't seen Epic in action yet. It is not popular in Europe, but according to what they describe, it seems to be a part of their commercial solution.
So the Polish Telemedicine Society is able to access the EPIC, the version for a non-governmental organization. So we can discuss about it and use it. Maybe prepare EPIC for use in Poland in the near future. It would be nice because they have incorporated several prompts inside, so that might be very useful for Polish patients.
Okay, we have thank you for this important update against the backdrop of the legal frameworks in Europe, like eIDAS and HDS from Stefan. We have a question regarding the cooperation with Africa. So this webinar is dedicated to activities in Poland and the Polish Telemedicine and eHealth Society. So we are, of course, interested in cooperation globally, worldwide. Wojciech, can you share about our current cooperations possibilities?
Certainly. Probably the panelist who could also answer this question is Hassan Ghazal, who is located there, and we are still in a good connection, and we are also open as a society to contact other societies and share our knowledge about it. So then we are open, and after the meeting, we can discuss it in details. So the next question.
I can take one. What were the key enablers, policy, funding, or institutional leadership that allowed Poland to move from pilot project to large-scale sustainable telemedicine services, and how transferable are these elements to other countries with different healthcare structures?
Well, let me try to answer this question. So, yeah, we have several opportunities to apply for funding the projects. The EU funding and Polish Ministry of Science funding. We have the two centers for funding it. But several projects we have done with our enthusiasm only, so they worked, and we are able to share how we did it and what is possible. There are several opportunities to connect with other countries to link together and make together the project in the international payer and find an international payer, including the EU funding. For several countries, it is possible. For example, the Morocco is one of the countries associated somehow with the EU scientific funding, and other countries probably too. So then we need to find a solution. There was a question about the nurses. So we selected the topics just to show just a piece of the problems we present here and we elaborate here in Poland, but they are not showing all of these issues we are working on. So the nurses are very important group for our society, and we have also open access, a very, very low membership fee for the nurses and students. So and then we are welcome nurses to take part. And several projects already been done. For example, the research on the surveys, how the telenursing is developing. And the survey has been deployed in 2013, I think, and it's still having citations and some followers. And I'm yearly 3-4 times asked to give the access and agree to use the survey for telenursing. So one of the examples, but it is very important for me personally.
Okay, so I can take another question. How is Poland addressing the integration of telemedicine into routine clinical workflows? And what steps are being taken to formalize digital telemedicine and clinical informatics as recognized medical specialties?
Yeah, there are two parts of these questions. One is how we are managing. So we have a great support for eHealth Center, that is agenda of Ministry of Health. So during the many years cooperation with several researchers and enthusiasts in telemedicine and eHealth that helped the Ministry of Health to develop several applications. For example, Project P1 that covers all the access to the information of the patient, of the health information, and opportunities to prescribe the e-prescriptions, e-referrals, and many more. So this is cooperation at the higher level of the country in the Ministry of Health. The second issue is addressed to what we are thinking and what we are doing to make the specialty, the new specialty, recognizable and needed. So the changes and all the digital transformation in all of the countries at the moment is leading us to have a specialist who is well trained in medicine, in clinically oriented, but having a knowledge in the field of informatics, in the meaning of health services. So we need to have such a person in between that will work as a interface or person interface from the informaticians who have very specific knowledge to the clinicians who also have the very specific knowledge, and provide the leadership as well, and help to understand all the processes in between the telemedicine, e-health, digital health, and the informatics, because it's really complicated. We can observe even in the electronic health records how the informaticians are thinking what will be helpful for the doctors, and usually the doctors are hating the improvements already made by informaticians who are not sitting in the same shoes. So this is a very important topic, and we need to work about it and elaborate it and make it done. The colleagues in the United States have done it already. They have a clinical informaticians doctors working in this field. So having finalized digitalization of medicine workflow and all the procedures in a digital way, we need to have such a specialists.
Okay, we are a bit far ahead of our schedule. After we took lots of time, so let's take two last questions. Will it be possible to connect with today's speakers after the webinar for the further discussions and potential collaboration? So quick answers, of course. The websites are available on the current slide. Please free to contact us, ask question, propose projects, cooperation. We are very open for the cooperation. And one last question is, I have one question. Do you use telemedicine in prison in Poland? So I'm not sure if we use it because it's kind of special environment, but I can tell you that the telemedicine is used, for example, in the region that require it more or maybe most. For example, the Polish Antarctic station, the ISfTeH station, the members of the scientific expeditions are being monitored and have provided the medical support aside from the local specialists. And of course, there is a cooperation with other stations like this, but in prison, I'm not sure, maybe someone knows.
I will just have the experience from the 20 years ago. I worked for the hugest provider of the telecom networks here, and we have some projects for the law ministry in Poland, and I remember that was created that network, VPN network for teleconsultation connected with some psycho diseases. So definitely it works by the telemedicine, and how I said, firstly is used like some kind of support of the psycho diagnosis and supporting the psychologist in the recommendations and the remote diagnosis, how I said.
Actually, I'm not able to give the exact contact person. We'll ask colleagues from Polish Telemedicine Society to find the person maybe who is familiar with that topic.
Very nice. I can see other countries are reporting contacts and experience in this area. So before the end, Frederick would like to announce the next webinar next month.
Thank you for all participants for attending this conference.
Thank you, everyone.
Yes, hello. And if I just may, to conclude, yeah, can you hear me?
Yes.
Hello.
Yes, we can hear you.
Yeah.
There is a slight delay and there was some problem with the connectivity.
We don't see you, but
I think
we
it
can
works.
hear you.
Okay, yeah. Video is running. Okay,
I can
anyway.
see you and hear you, Frederick.
Okay, good. So thank you to the Polish Telemedicine and eHealth Society, our national member for Poland in the ISfTeH. Thank you for putting this webinar together with many of your members, and I'm sure there's much more to tell, other initiatives, other activities in Poland as well. So we have material for more webinars in the future. But so this webinar has been part of a series that has been started earlier this year, where each month we feature a specific country through our national member society. We already had Finland, India, last month Nigeria, and so this month the focus was on Poland. And for next month, we will be working together with our national member society in the Czech Republic. So that will take place in the month of May, around the same date as now in the middle of the month. So we'll share details in the next few weeks, the date, the time, and the topics that will be presented. And then the series will continue with a focus on other countries as well in the next few months of this year. So thank you again to all for joining. Thank you to all the speakers and presenters for your contributions today. And we look forward to seeing you in the future in our next webinars. Also, all webinars are recorded and available on our YouTube channel. So check that out. And for any further information or questions, as was mentioned before, contact the Polish Telemedicine Society regarding any questions about the presentations of today, or contact us at the International Society for Telemedicine if you have any questions or if there's anything we can help you with. Thank you next time.
Thank you, everyone. See you next time. Stay healthy.
Thank you, Poland.